Good morning. Thank God it's Friday, and thanks for joining us on TVC Breakfast.
And we're streaming live on YouTube. You can also connect with us on Twitter using the hashtag TVC Breakfast.
Well, let's head straight to the news now. The two police officers alleged to have shot and killed KOLADE Johnson on Sunday have been subjected to internal disciplinary proceedings.
In a statement, Police Public Relations Officer in Lagos, OLALEKAN, disclosed that the orderly room trial in which 5 witnesses testified began on Monday and has now ended.
Mr. Ekane says the officers were tried on 3-count charges, including discreditable conduct as well as unlawful and unnecessary exercise of authority.
Well, the conclusion of the trial, the first officer, Inspector Ogunyemi OLALEKAN, was found guilty and dismissed from service as he awaits prosecution.
The command said there was no evidence linking Sergeant Godwin ORJI to the shooting, and he was discharged and acquitted accordingly.
Well, the dismissed officer has now been handed over to the Criminal Investigation Department for trial.
Now, staying with the murder in Ondo State, the police has launched an investigation into the killing of the bossa of Akure Diocese of Anglican Communion, GABRIEL, ABIODUN.
The spokesperson of the command, Femi Joseph, assures residents that the killers will not go unpunished.
ABIODUN has details.
It was a sad day for members of the Anglican Communion in Ondo State as the bossa of the Akure Diocese, Gabriel Kola ABIODUN, was killed by unknown gunmen at the diocesan office in Alagbaka area of Akure. He was trailed from the bank where he went to withdraw a sum of 500,000 naira for the church. The men of the underworld killed him and went away with the money. His blood litters his office and the floor next to it. Church members have continued to throng the office to mourn the late bossa. His death to them is shocking. Venerable Blessing Aregbeshola described the incident as unfortunate.
As he was entering, 2 people followed him. And before you could say Jack Robinson, we just had gunshot. We dashed out to help him. And before we got to the hospital, he was dead. I know it's under $1 million. It's money to pay the retirees and maybe church evangelists.
Meanwhile, the State Police Command says it is investigating the matter.
In the ensuing melee,
the spokesperson of the command, Femi Joseph, assured residents that the killers were brought to book.
The man was shot, his 2 legs. So before he could be rushed to the hospital, we lost him. Now we have embarked on a manhunt to ensure that we bring the perpetrators to book, and I want to assure you that in less than no time, we will ensure that they are brought to justice.
As members of the Anglican Communion in the state mourn, they want the police to expedite action on the matter and bring the killers to justice. Ayodeji Morade, TVC News, Akure, Ondo State.
And the heat wave being experienced in Nigeria is a source of concern for many, especially those in the northern part of the country.
Well, according to the Nigeria Center for Disease Control, cerebrospinal meningitis has claimed 48 lives. 541 suspected cases were reported from 15 states. That's between October the 1st last year to 27th of May this year.
Now, states in the meningitis belt were formally placed on alert on the 8th of November 2018. Joining me now is a medical doctor, Tui Mebaundu. Thank you for joining us on TVC Breakfast this morning.
My pleasure.
Now, 48 lives have been claimed by the outbreak of meningitis, and then there are scares of fake vaccines in circulation as well. What are the complexities we are being faced with? And then there is a heat wave.
Yeah, really complex. We know that every year we have the resurgence of meningitis. The worst episode had been that one of 2017, but after that large number of people died, the number reduced in 2018. And now, going to the peak, we're having about 48 people dead already. Now, essentially, we know the meningitic belt. We know that this place is housed to overcrowding, it's housed to malnutrition, it's housed to malaria, and of course, it cuts across 26 countries, different countries from Senegal right down to Eritrea on that belt. And we know that the heat actually helped the spread of these germs, Meningitis meningitis, Meningitis meningitis that causes this the disease. So the heat is there, malnutrition is there, malaria is there, overcrowding is there. These are key factors that help to spread those things. Now, for us, we'll be able to push back the incidence of meningitis, the occurrence of the meningitis by vaccination, massive vaccination. For now, that's what we have to keep repeating while we push. But now
there's a call that there is a scare for fake vaccines.
Yes, from Niger Republic, of course. That makes it so difficult. Now, what we need to do, honestly, is we have to enhance pharmacovigilance. And then NAFDAC, we need to emphasize the fact that if you want to take your vaccine, go to this designated center to take those vaccines. And of course, we have the challenge of those vaccines because let's face it, the Gavi, who is sponsoring the vaccine, the Global Alliance for Vaccine Initiative, they're having challenges in supplying the number of requisite vaccines for us. We should have been able to have an indigenous production of those vaccines to help our people, because we know next year, from October again to April,
there's going to be outbreaks. Is it preventable?
Yes, absolutely. The way you can prevent it is vaccines. Yes, Bill Gates and co. brought money around 2001 and vaccinated as much as 25 million people against a strain A meningitis. But we have other strain C, Y, and W. So we need not a monovalent, we need a polyvalent vaccines that can help vaccinate against all these strains, and then we keep, surveillance, epidemiology on to look at outbreak. And then
now, why do people die from this? Is it because it wasn't properly detected, or they didn't go for treatment early enough? Meningitis
attacks the vulnerable, especially the young children and the old people, and then because it's a very fatal disease, affecting the lining of the cerebral membrane, leading to deformity, leading to death. So it's very fatal and can even lead to some other complication in the lungs and other system of the body. So it's a very fatal disease, and it requires a quick detection. You need to pick it quickly. But when you look at human resources for health, you remember Sanfara at that time, the total number of health workers in the whole of Sanfara were not up to more than 100. So it's worrisome. Health workers, including doctors, nurses, pharmacists, and co., they are not more than 100.
All right, quickly, we need to touch on why it is not easily detected. Does it have the symptoms? Does it have similarities with that of malaria?
Yeah, it has similarities with ordinary cold. It's fever, cold, headache, photophobia. I mean, the person cannot really look at the light, and before you know it, the person starts convulsing. The fever is actually a high fever. By the time the person is convulsing, affectation of the brain has happened. And when that happens, the next thing is that it damages, and then if you don't initiate appropriate treatment on time, before you know it, the person is dead.
Initiate appropriate treatment on time when it comes to meningitis. Tuyi Madebawodu, thank you for your time on TVC Breakfast.
My pleasure always.